Hey everyone, welcome back. My name is Joette Springle, Vice President of Business Development and Marketing with Legacy Healthcare Services. I am here with Julie Galla, Vice President of Clinical Strategies from Health Pro Heritage. Julie is going to break down the latest on Advanced Beneficiary Notice, or ABN, and how these updates will affect Medicare coverage. So thanks for joining us today, Julie.
Thanks for having me, Joette. It's great to be here to discuss these important changes with you.
Absolutely. So let's start with the basics. Can you explain to our listeners what an Advanced Beneficiary Notice, or ABN, is and what its purpose is?
The ABN is a notice that healthcare providers give to Medicare beneficiaries to inform them that Medicare might not cover a particular service or item. The key purpose here is to protect patients from unexpected costs by letting them know in advance that they could be financially responsible for the service if Medicare does deny coverage.
Thank you. So now let's talk about the updates 5. What changes are happening regarding the ABN for outpatient therapy services?
Yes, there are some important updates in 2024 that we went through that were especially important for outpatient therapy services like PT, OT, and speech therapy. The ABN is now required if Medicare may not cover these services for reasons like medical necessity or exceeding the frequency limits for treatment. Providers will also need to use the updated ABN form, which is CMS ABN 14. I have that emblazoned on my mind, and it must be delivered and signed by the patient before any therapy service is provided. That's a key change here.
So when exactly should a provider issue an ABN to a patient?
That's a great question. Providers should issue that ABN when they anticipate that Medicare might not cover the therapy services. Typically, this is going to be before the patient even signs up for therapy to begin, so the patient knows upfront about the potential financial responsibility.
And is this requirement just for Medicare, or does it apply to other insurance plans as well?
Yes. So the ABN is specifically required for Medicare Part B services, including that outpatient therapy component. It also applies to Medicare Advantage plans or managed care plans, though the rules for these plans can vary slightly, and providers need to make sure they're checking the guidelines for each Medicare Advantage plan before issuing that ABN, just to be sure that they're following the correct procedures.
That makes total sense. So where can providers go if they need more information on ABNs and the guidelines for outpatient therapy services?
So for more details, I highly recommend CMS website. So for Centers for Medicare and Medicaid Services, it is truly the best resource. They have a dedicated page that covers everything from the ABN form to the policies around outpatient therapy services. That way, providers can stay up to date on all those rules and requirements.
That's perfect. Thank you so much, Julie. We appreciate you breaking all of that down. And it's clear that staying informed about these updates is critical for healthcare providers. And we just appreciate you taking the time out to join us today, Julie.
Oh, thank you so much, Joette. It's my pleasure. I'm glad I could help clarify things. Thanks again for having me.